I was very disturbed that on the film you said that you cured cancer immediately. And I would be concerned that vulnerable people who may have cancer may come to you, may delay seeking orthodox medical treatment, which might be curative, and thereby might forego their chance of being cured of cancer.
I'd like to say, people come to me after they've been to a doctor, after they've been to the hospital, where the doctor and the hospital can do no more for them. They can offer them basic no hope. Secondly, yes, cures have happened.
And presumably you have the medical evidence that they had cancer to start with.
Oh, yeah. There's one chap, and he was told by a consultant that he had a tumour on the spine. Incurable, could not operate, given so long to live. Oh, let me finish, you've had your say. Dr. Khan came through, operated on him, worked on him. The man felt immediate improvement, immediate. Now, the very next day, and this is testified to, the very next day, he had to go to the hospital for his appointment. The consultant checked him and called, as I understand it, for further tests on the man. When they done the test, the tumour was gone.
I haven't seen that evidence.
No, because they've not showed you it.
In this day and age, we're all very concerned about the transmission of infections, everything from hepatitis to HIV disease. And I was very concerned to see that you weren't wearing gloves, you didn't sterilise your instruments, and that you might possibly transmit infection from yourself to patients, from one patient to another.
When Dr. Khan speaks, he would tell you that you cannot get any infection from what he does. He can cut you open with a rusty knife.
Yes, but I'm concerned about people who might be vulnerable. You say that the patients you treat are people who are at the end of their tether. Mm-hmm. People like that can be very open to influence, and I would be concerned about the risk of infection. I also would like to know the scientific rationale, if there is any, for putting a pair of scissors up somebody's nose into the nasopharynx.
Well, let's put it this way. Rationale, looking at psychic surgery or any form of the paranormal, you can always say rational.
Some diseases can be exceedingly difficult to diagnose. I would suspect your powers of diagnosis. There may be things that people will come to you with that you cannot diagnose, and they will indeed delay seeing your doctor.
I certainly don't diagnose. I have no medical understanding whatsoever. The good doctor that controls me, that takes me over, he diagnoses. He will do what he can to help that individual with, I must state, outstanding success.
We have another guest in our audience today, among many. Professor Margot Brazier is with the Faculty of Law at Manchester University. Margot, perhaps you could share with us what legal questions you think that these practices might raise.
Well, the first question, of course, is can anybody who likes practice medicine? And the answer actually is yes. The Medical Act makes it an offence to pretend to be a registered medical practitioner, but it's not actually a criminal offence in England to practice medicine with no qualifications at all.
Is there any cause for believing that assault might be committed in these operations?
Even if it's only a tiny wound, a tiny cut, that is an assault. And the consent of the victim is immaterial unless it's one of the recognised exceptions that the law permits and sanctions. Now, this includes reasonable surgical interference. If there ever was a court case, the question would be whether the court considered psychic surgery to be reasonable surgical interference.
What about adults who should have the good common sense to know whether they go to a man like Mr. Turoff or not? But what about their children? If they take their children in there, are they to blame at that point if something goes wrong?
They might well find themselves to blame. Parents have a duty to ensure that their children obtain adequate medical care when it's necessary.
Well, we have Mrs. McMillan in the audience this evening, and Mrs. McMillan, I believe that you take your 14-year-old son regularly to see Turoff rather than your GP. What do you think, having just heard the legal situation from Margot, does that change your attitude at all?
No, not at all. I'd always take my son to see.
You'll continue to take your son?
I will do so, yes.
Yes, ma'am.
I have a son who's almost 33 years old, and since birth He has suffered from cerebral palsy and has had incoordination of his limbs. Almost a year ago, I took him to Mr. Turoff, and he had surgery from Dr. Khan, and he is perfectly well now. He asked me to come on his behalf tonight to speak and say that he is perfectly fit.
I have seen many cases of healing. What goes on isn't magic. Sometimes all that's happened is that the healer has given the person the permission to get better. And the person didn't have the permission before because of the whole family setup. Sometimes the person has wanted to change but needed some kind of push. It's been a very, very temporary healing. I've seen plenty of people get up from their bed of pain and walk, but only for a day or two, and the healer wasn't there to check up a day or two later.
No one can be all things to all people. I could be mystically employed if I so desired, but as a working man I have to see not 20 people a day but 60 or more a day.
Yes, ma'am.
It's time now that we conducted a proper scientific study, and it's made impossible by the prejudice of people who believe that it's dangerous or that one's abusing people who are very vulnerable because they're afraid of dying. I don't disagree with any of those points, but what you all may be missing is that if, in fact, as I believe, healing has something very genuine to offer humanity, it will alleviate suffering. I'm sure it saves lives in some cases. I'm prepared to offer my services to any casualty department in the land if you can find one with the guts to take me up on my offer and watch me work. My work is not intrusive. I work with people outside of the body, about 2.5 inches off the body. I don't particularly understand what's happening, but I do know that it works.
There are experiments going on at the moment that have been organized through the BMA so that certain illnesses that they have said can only be remedied by surgery have been given to various healers. We don't know what the results are, but there's no doubt that it has been looked into.
It's unfortunate that we've received just recently a couple of patients from Mr. Turoff there, one with a back problem and one with a cancer problem. And I quite frankly would have liked to have had a word with him before the program started.
What would you have said to him?
I would have said that two of his patients had come to us with a problem which they purportedly had got rid of, but it was still there.
I cannot cure everybody I see. I don't pretend to cure everybody I see. I say to anybody that comes to me, I will do what I can to help you.
I think that we're seeing here a wonderful attempt at having power without responsibility. You want to be a very powerful person, you're demonstrating a great deal of power there, and at the same time you're saying, I am not responsible for what I do.
Let me tell you about a research group called the Inner Mind Foundation. Recently at the Portchester Halls in London, they held a symposium on psychic surgery for hundreds of people. Committees of bishops, doctors, and magicians attended, but the media were deliberately excluded. Father Crosswaite, you are the chairman of the Inner Mind Foundation. How many psychic surgeons performed at that symposium?
There were two.
Two of them. And what did they do?
One of them made an apparently, he claimed, a paranormal incision and attempted to remove the tissue from inside the body, and the other, in fact, didn't perform any so-called psychic surgery, merely manipulated and laid hands on the patients.
We have sitting right beside you, Professor Arthur Ellison. Pardon me, Professor. You were the scientific advisor to this symposium on psychic surgery, and you're also an officer of the Society for Psychical Research, I understand.
I looked very carefully indeed, with an open mind, and I could see what I would call normal explanations for what was ostensibly paranormal.